the spine surgery nurses here at WashU. We've put together this series of videos to help patients prepare for their upcoming spine surgeries. Today, we're going to be talking about exercise and its important role in spine surgery. These videos are not intended to replace your physician's advice, so just make sure that you talk to them before making any health changes. So, what are the recommendations for exercise? The World Health Organization recommends 150 to 300 minutes of moderate intensity cardiovascular exercise every week in 10-minute or longer periods, or 75 minutes of vigorous intensity cardiovascular exercise per week in 10-minute or longer periods. And we're going to talk about what both of those mean. Their other recommendation is 2 to 3 days of strength training of the major muscle groups each week. 80% of spine patients are not meeting those exercise recommendations, and it really does put patients at a disadvantage when they're not able to be physically active. So, what are the potential benefits of exercise before spine surgery? Patients who exercise routinely have less pain after surgery and before surgery. They have a decreased fear of activity. One of the things that we encounter is that patients are afraid to get up and move after surgery because they're afraid that it's going to hurt or cause some kind of complication. So, patients that are exercising beforehand have less fear of that than patients that don't. Patients who exercise have improved walking ability, distance, speed, and better gait before and after surgery, and they maintain that improvement after surgery as well. They have shorter hospital stays, as I mentioned, sustain improvement in their activity levels after surgery, and patients who exercise have a lower chance of falling than patients who don't exercise. What are some of the barriers? Why aren't patients doing this? Well, you guys probably already know that. Most patients are afraid of pain or injury with exercise. Just like everybody else, spine patients have a lack of time. They're busy, they're working. They're afraid of their poor health status. So maybe they've been deconditioned for a long time because of their spine issues, and that may make them hesitant to start or afraid that they're not going to be able to exercise. Lack of access to exercise facilities, especially right now, we're in the middle of the COVID pandemic, and it's hard to get places to exercise. It can be expensive and it's more of a time burden. And then some patients just don't realize how important exercise is, especially in the setting of a spine surgery. So that's what we're here to teach you. So cardiovascular exercise is exercise that increases the heart rate. For most spine patients, low impact activity is going to be better tolerated. So low impact activities are things that aren't going to jar your joints or your spine as much. So swimming tends to be well tolerated by our patients. Cycling often is well tolerated, especially because you're kind of leaning forward when you do it, more so than things like running or walking or jumping. So those World Health Organization recommendations talked about moderate intensity and vigorous intensity exercises. And so I have some of those listed here for you. So the moderate intensity, and we're shooting for that 150 to 300 minutes per week in 10-minute periods, include things like slower casual cycling or bike riding, water walking and water aerobics, hand pedals or hand cranks, walking on an elliptical at a moderate pace, or just walking, yoga, doubles tennis. So those things that are going to get your heart rate up, you're going to break a little bit of a sweat, but generally you're able to hold a conversation. You may even be able to kind of hum or do some light singing while you're doing it. Vigorous intensity exercises obviously are more vigorous, they're more intense. So again, we're looking for 75 minutes per week in 10-minute periods. So 15 minutes, 5 days a week, something like that. So that's cycling faster than 10 miles per hour, lap swimming for exercise, race walking, jogging, or running, aerobics, Zumba, fast dancing, all of those things, singles tennis, and then high intensity yoga and Pilates. And generally with vigorous cardiovascular exercise, you're probably not going to be able to hold a whole conversation. You should still be able to talk. You should not be so winded that you can't speak, but it's going to be difficult to maintain that ongoing conversation. Strength training, working on strengthening the muscles up. And again, we're looking for all of those major muscle groups. So that's going to include your core and your back, your upper extremities, arms, hands, and then your lower extremities. And we're looking for 2 to 3 days per week with at least 2 rest days in between. We're, looking for you to kind of stress these muscles, and you may be a little bit sore afterwards, which we'll talk about. But we want to have time for the muscles to recover and build new muscle fibers. That's how they get stronger. And they can't do that if they're constantly being stressed. So we do need to make sure that you have rest time in between for this. So some examples of core and back exercises can be things as simple as a pelvic tilt or lift, a Superman flyer where you're on your belly with your arms and legs extended up in front of you and behind you. A bird dog is actually what this picture is showing right here. Crunches, not sit-ups. Sit-ups are terrible for your back. So really just tightening your abdominal muscles enough to pull your shoulder blades off the floor, but not all the way up to your knees. Planks and side planks both tend to be pretty well tolerated by our patients. A hip bridge and bicycle kicks or flutter kicks, all of those things are great for working the core and the back. Some examples of upper extremity strengthening, triceps extension, so bringing your arm up and working that triceps, biceps curl, bringing your arm up, deltoid and shoulder flies, wrist flexion and extension exercises, grip strength, and then seated push-ups are all examples of those. Resistance bands work really well for this stuff. So they're really versatile. I would recommend picking up a set of cheap resistance bands. You can get them for 15, 20 bucks on Amazon or Walmart. And you can do them anywhere. And there's a variety of exercises that can be done with them. And you can look these up on the internet. You can find really good programs that use those resistance bands, but you can also just start out with light hand weights, soup cans. You really need to kind of start where you're at. So, just make sure that you're kind of starting low and going slow. Lower extremity strengthening exercises. So strengthening up those legs. So you can do things like a single leg calf raise, just standing on one foot with you holding onto the wall, and then go up on the tippy toes of that one foot. Hip abductor flex, wall squats to help keep your core stable and keep you from falling, standing hamstring curls, seated leg extensions are so easy. You can do them all day at your desk. Standing forward kicks and standing hip extensions are all examples of exercises that can be done for the lower extremities. And again, these are something that can be done with resistance bands at home. You can tie those resistance bands into a loop. You can use your other leg for resistance. You can use a chair leg or a table leg for resistance, and you can really get a lot of good strengthening and stretching exercises with those resistance bands in the comfort of your own home. You don't have to go anywhere. The alternative is also to use ankle weights. They may be a little bit more stressful on the back. So again, you need to start with low reps and go slow with them. So what are some tips for exercising? Well, this guy here, he has resistance bands. So it shows you that all kinds of exercises and can be done with them, and all kinds of people can use them. But the best thing is to start immediately. Any exercise is going to be better than no exercise, especially with an upcoming spine surgery. We want you to be active. We want you to maintain that level of activity. So it's important that you just get started and kind of keep building as you go. I said this a few minutes ago. You want to start low and go slow to avoid an injury. When you're increasing your activity, you want to do it by less than 25% per week. So that means either not to increase by more than 25% of your reps or your weight or the distance or the speed. Some patients, 25% may even be too high. You may want to consider increasing more like 10 to 15% and seeing how you do. But you definitely don't want to increase by more than 25% because you're increasing the risk for injury if you do that. You should always warm up before and after exercise. So a 2 to 3 minute cardio warm up and cool down before and after any exercises, including the strength training. That may be just a brisk walk up and down the hallway or around the dining room table. It could be a little bit of like jogging in place, whatever you do to get that heart rate up. And that's also going to warm the muscles up. We don't want to stretch muscles until you're done with your workout. Stretching cold muscles, doing it at the beginning of an exercise, increases the risk for a muscle or tendon injury. So make sure that we stretch afterwards, not before. It's normal to be sore after exercising, but it really shouldn't hurt. So if you're having pain, that's an indicator that maybe you've done too much too fast. So some muscle soreness is to be expected, and it can be improved with moist heat, ice, both of which 15 minutes, a couple times a day, and then gentle use of the sore muscles. So the next day, you don't want to just sit around and be sore. Go for a little bit of a walk. Um, just make sure that you're using those muscles and you're going to see them improve better. If you truly have pain, if it hurts, you need to stop the exercise. You should not push through that. That's a sign that you're either going too fast, it's too much, or that for whatever reason, that's not the right exercise for you. So when that happens, I recommend stopping, pull back next time. If you still want to try that exercise, reduce it by about 30% and then start going again a little bit slower. Again, that 30% could be the number of reps, it could be the weight, it could be all of those things. But you're probably just starting too much too fast. So make sure that you back off a little bit. And then, of course, you need to monitor those symptoms, and it should get better within a few days. If you exercise, you have pain, and it's not better within a few days of doing the exercise, you need to call your doctor. You also need to call immediately if you have any new persistent numbness or tingling in the extremities, new or worsening weakness, loss of ambulation, or if you have any loss of bowel or bladder control. Your physician's office, your surgeon needs to know about that immediately. And then the last thing is to ask for help with exercise. So we have a great program here in the Department of Orthopedics called the Living Well Center, and they can help with physical activity, with physical therapy, with exercise guidance. They're fantastic for that. So you can get more information about the Living Well Center on our website, ortho.wistel.edu. You can ask your surgeon for a physical therapy referral to help you and get some guidance in terms of strengthening. And this is especially important if you have not been able to be active and exercising on your own, for an extended period of time because of your spine problems. A personal trainer or an exercise coach can help you reach your goals and can help you do it in a way that's safe and is going to provide good exercises that are going to be well tolerated by you and by your back. Finding an exercise buddy for accountability. So exercise is more fun when you do it with somebody else. So having somebody with you just makes it more likely that you're going to do it. You can also use a fitness tracker like a pedometer, a Fitbit, an Apple Watch. Pedometers can run as inexpensive as $5 and counts your steps throughout the day. And you can really see kind of where you're at and use that as a good judge for how to increase that. It gives you good objective information on how much exercise you're actually doing. And then record your progress. So a paper chart, an app, whatever you have to do to see the gains that you're making. Sometimes people don't realize that they are actually making progress. And it's a good way of motivating yourself to continue to exercise. So again, we do want you to be exercising. We want you to be physically active. Your surgeon and their office are here to help. So feel free to reach out with any questions. Thanks for listening.